but different folks struggle with different healthcare needs. And some people have chronic conditions, right? And some people have things that they're trying to actually be proactive about. And it's so financially prohibited to be on the other side where you're like, okay, I'm not just going to address the things that are broken, smoking, and on fire. I want to actually stay a step ahead in my health. And it's just bizarre. It's absolutely bizarre because I've been thinking a lot about it this week. What people do, so me burning up a tax refund to get my healthcare needs taken care of, that's certainly one option, but it's not great. And I was wondering, with you and your financial expertise and the corner of the market that you work in, has healthcare come up as a concern with the people that, with your clients? Like, have they asked you for help budgeting that? And have you had any creative solutions for them?
The content presented and discussed is purely intended to be general and educational in nature and should not be construed as specifically tailored investment, financial planning, tax, legal, psychological diagnosis, or other professional advice.
Hello. Thank you all for joining us. This is another episode of Ask My Man Manny with Dr. Abbey Durkin and myself, Manny Henson, CFP. And so I have a good conversation I wanted to get started with everyone today, and that's around healthcare. Healthcare costs are going through the roof, but at the same time, there's some proactive things we can do. And we're going to talk about that. I want to kind of give the ball to you, Abby. When you think about kind of healthcare, what are some of the things that kind of come to mind?
Well, I guess just the sheer level of absurdity that it's reached. For the past several years, I've had like chronic knee issues, right? So I've been going and getting knee surgeries and things that I've actually needed to do to improve my mobility. And just ranging from the absolute sticker shock value of getting these statements in the mail saying, yeah, this is covered by insurance, but oh, look here, see, you actually had your surgery done in a facility that wasn't covered by the network. So the surgical costs of that actual procedure are $27,000, but the surgery itself was covered, right? And just melting down, it's been going on. Well, I guess my first knee injury was when I was 17, and then I was in the military, and then there was like issues after that. But then, with other things like little odds and ends, I honestly, I used to wait every year to get my tax return. And my tax return, I don't know if anybody else can relate to this, but I literally would have to spend my tax return on healthcare costs, whether it was, reactive or proactive, just to stay afloat. And I can't be the only person. I can't be the only person that had to do that. And I wanted to open up that topic because, it's July, but different folks struggle with different healthcare needs. And some people have chronic conditions, right? And some people have things that they're trying to actually be proactive about. And it's so financially prohibited to be on the other side where you're like, okay, I'm not just going to address the things that are broken, smoking, and on fire. I want to actually stay a step ahead in my health. And it's just bizarre. It's absolutely bizarre because I've been thinking a lot about it this week. What people do, so me burning up a tax refund to get my healthcare needs taken care of, that's certainly one option, but it's not great. And I was wondering, with you and your financial expertise and the corner of the market that you work in, has healthcare come up as a concern with the people that, with your clients? Like, have they asked you for help budgeting that? And have you had any creative solutions for them?
Oh, you're absolutely right. And, this is a big conversation that I'll have this fall. And so a lot of people don't think about healthcare decisions as being a financial decision, but it's a huge one. And so think about, my elderly folks who are with me. If you are retired or you're married to someone who retired military and you're over 65 and you're low income, you probably have about five different options for healthcare insurance. You might have health insurance from your employer. You have Medicare. You might have Medicaid. You might have TRICARE. You might have You might have a state Affordable Care Act plans, and it just can be overwhelming and a dizziness of options. And so for my elderly folk, that's one conversation. That's a rather lengthy one. And even for my younger folks who are in our age group, they're working, have families, it's also still a big deal. And so for me, as a family of four, it's something I struggle with like every year. It's you have to kind of guess what your actual costs are going to be, and then figure out a plan type that makes the most sense. I think most employers are moving towards a higher deductible and making sure that you have the biggest pain up front so that you can catch medical errors in billing, and there's an incentive for you to save and be conscientious when you do use your health insurance. And so there's no panacea, a way to get around any particular one, but I have found like a number of different areas that are useful. One is when you go to look at your plans in October or whatever period of time that you have to start looking at a new plan for the next year, just give yourself some time to digest the information. If you're married, you're a couple, you have perhaps more than one employer plan, don't just go for the one with the lowest out of pocket. So sometimes if you have a PPO plan, you might be paying a little bit higher in premiums, and then get a higher cost share, but you might be getting a plan that costs more than you actually need to. And then also there's tax advantaged accounts. So if you have a HSA, which has to go with a high deductible health plan, that deductible might be high, but if you're in a high tax bracket and you're a low to moderate user, you're going to be able to save money on taxes that well and offset the out-of-pocket cost of going with that deductible. There's a number of different situations. Not everyone's different, but just give yourself some time and not just re-enrolling into the old plan you had last year because it's easier and you don't want to have the time to discuss it. And so another part of it is shopping around. And there's rules that came out maybe a couple of months ago. I forgot the act, but they're making it more transparent for you to compare and contrast costs. MRI one place might be $500, whereas an MRI at another place might be $2,500. And it used to be a case where you couldn't get that information, couldn't find it. Whenever possible, whenever you can, not everything is something you can time, but to your point, but whenever you can, go to your plan's website, because they're the ones that know the agreements with every hospital, to know the reimbursements, and you can go ahead and do a reverse lookup. So after you have your primary care physician or your specialist say, hey, I need you to go get this procedure, they might give you what's called a procedure code, and then you can plug that into your health insurance plan website, and it will show you which facilities are covered and what the costs might be out of pocket. And again, it's not something you might hope, you have emergencies happen, but that's something to do. And in most cases, you have a deductible for in-network and a deductible for out-network. And so maybe, sometimes you might have to have another specialist. I've had specialists that are not in network, but because I believe in that value of that service, and when they have to pay out of pocket, and then I can submit reimbursements up until to my plan, because that's what that typically means, is that the insurance plan will cover it, but I have to do the work. I have to get the receipts. I have to go back to the insurance plan to submit them. And if it's above the deductible, then I start getting some of that reimbursed back to me. And so the healthcare industry does not make things easy. And so you got to know the tricks of the trade.
Yeah, I'm wondering, with your clients, have you experienced anybody having to do a complete financial portfolio overhaul because of a healthcare crisis?
Yeah, I mean, I've had over years where people have been in situations where it's become a little bit easier more recently because first and foremost, if you go on a payment plan with a medical provider, oftentimes you can give them a couple of dollars a month and they cannot affect your credit score. And so if you have a medical debt and you pay them something, $50, $100, after 7 years, after some period of time, you might be able to say, hey, there's that debt that was originally out there that I can't pay, and just ask them to wipe it out. And that's the worst case scenario. I know that. And then bankruptcy is tough. I think since they've going away with the plan limits, there used to be a case where you can have a plan limit on an employer plan of $1 million or $2 million. That was very common for people. Some people would get bankrupt if you have a major cancer battle or something, something that's very extraordinary. But I think the first step is reaching out to them and saying, look, here's my situation. I just can't afford it. Can you put me on a payment plan? I'll pay you $50, $100 a month until, until it's going away. And then maybe at some point, if you can get them down to a point where it's reasonable, you can ask them, if there's any kind of assistance or help you can get. A lot of times the hospitals have like a foundation attached to pay for bills that can't be paid for middle income earners. It's not just low income earners, but middle income earners might be qualified for too. And then they can reduce the bill. So I think most of the time, I have no guarantee that this is because I would love to talk to a medical professional. I feel like the prices are inflated a little bit upfront to deal with the fact that some of those payments won't be paid. And so then definitely with the companies who buy the debt, that they're buying on pennies on the dollar. So you can negotiate with them for some fraction of what they're telling you owe. And they'll be just as happy of getting something rather than nothing. And I know, like, this as a financial person sounds like crazy. You're supposed to pay every bill you have. Health insurance is bankrupt so many people. I really don't see an option around it. It doesn't matter how wealthy you are, how smart you are. If you get entangled within the healthcare system, you can bankrupt yourself. It's no way around it. And so it's about choosing the best worst solution.
Yeah, it was crazy. It's absolutely crazy. I've had a few health scares, and being a single mom for my whole life, one of my health scares, I needed an emergency surgery. And this was back in like 2016, 2017 timeframe. And I went, and the surgery was a success. I'm obviously still here, able to talk to you. But while I was recovering, the bills did not stop. I got one statement, and it was a pretty average amount. Like I had kind of expected it would be about $5,000 out of pocket after insurance had taken over. There'd be that bill. Well, I'm laid up in my house, and I get another bill in the mail, and this bill was for like $60,000. And it was related to the facility costs of where the surgery happened. Now, the surgery was covered, the surgeon was covered, the other doctors were covered, the nurse, et cetera, down the line. But there was some feature of the building that wasn't covered that I had no idea was even a thing, right? So I couldn't be proactive about it. I couldn't make that phone call to the insurance and say, hey, I found out that this particular surgical pavilion within this medical campus isn't covered, right? So I'm sitting there, and I'm looking at this bill, and it was $60-something thousand. And again, single mom, I was in student loan repayment at the time. It was a nightmare. And so I do what you suggested. I pick up the phone, I call them, I'm sobbing, right? Because my little boy, he was in middle school, right? And I'm crying my eyes out, and I'm like, this is it. I'm just gonna bankrupt myself. I'm gonna have to move. I can't afford this little 2-bedroom that I'm in. My kid's gonna have to change schools. I'm gonna have to sell the car. We're gonna be like walking on the bike, on the bus. We're gonna have to be asking our friends to take us to the grocery store. Like there's just no way. And so I'm crying and I'm on the phone, and they said, "Oh, yeah, that. Don't worry about that. If you say that you can't pay us, we're just going to go ahead and rerun the bill like you're uninsured, and then we will send you
Mhm.
the cost as if you were on Medicare, Medicaid." And I was
Yeah.
flabbergasted. I was like, "You're going to what?" And it was that crazy. So they reran the bill as if I didn't have insurance at all, which I did. Like I had actually really good insurance. It was super expensive, right? They reran the bill as if I didn't have insurance at all. And then they sent me a
Mhm.
number that was like a fraction. I still
Yeah.
had to cut some really horrifically crazy corners to get
Mhm.
that paid without going into even more debt that we were in. But I had never heard of such a thing, and I thought this whole thing is an absolute sham. Like you you can call and say, "I'm sorry, I don't have the money," and then they rerun it as if you are a completely uninsured person, and then they send you the bill at the end of that. And oh God, you know what I'm saying? It's been absolutely crazy.
And that's how it is, and the price that they say that you need to pay is based on a number of different factors. I was looking at a my family was looking at a specialty medication, and it was something about $8,000 for about 2 months and out of pocket. And we just called the manufacturer, and there's a rebate for the whole amount. And so we paid nothing out of pocket. But if you don't call, a lot of these drugs, they what they tell you what they tell you at up front is not necessarily the true price. But if you call the manufacturers, a lot of these specialty drugs or any kind of medications, you can negotiate with them or ask them if they have a rebate, and a lot of times they do. But it's not always passed along to you at the pharmacy. That's another one. And
Wow.
so I wish at some point, there's been a lot of conversations around single payer, and it's just, every other country has some particular use case of how it works. And it's been so long that we've been studying it. But I wish at some point there's more attention to this question. Like, even if for us, like as business owners, right? You think about starting your own business. I mean, one of the first questions I ever have, if I'm talking to someone who's I'm mentoring and they're asking about starting your own business, is okay, how are you going to handle your healthcare needs? Like, you cannot be, a financial advisor if you're thinking about going independent, and not having health insurance. Like, or how are you going to do that? And so it's
Wow.
it doesn't matter how smart you are, how sophisticated you are. It's a conversation that anybody can relate to because it affects us all. And I think one of the issues is the complexity of choosing the right plan, and then just being consistent
Yeah.
with monitoring what I did with the high deductible health plan too is, a lot of people choose not to do it over the PPO plan, especially high income earners, because they just don't like the idea of the uncertainty. But I suggest people look at that because it's enlightening. I remember the first time I switched to high deductible health plan, I started catching problems and started looking at what the health insurance companies were actually getting billed and catching issues at the provider level. And so that's the whole purpose of it. You're saving some money. Yes, you might have some upfront costs, but by virtue of the way our system works with Medicare, out of pocket Medicare, Medicaid, or deductible and expenses beyond the premium, you can get you can pre-fund those costs pre-taxed and occasionally have that money rolled over for year to year. So for a lot of my clients who are younger, maybe they haven't had a family yet, I would urge them to consider, high deductible health plan if it's right for them, along with HSA, and then fund it, because it's one of the only vehicles through fringe benefits which give you triple tax benefits. And so your money you contribute to an HSA, triple tax benefits. So the money you put in through HSA is excluded from payroll taxes, your state, federal, most states, and then it grows tax deferred until you use it, and it comes tax free if you use it for health expenses. And even if you're older, you're thinking about retiring at some point and going on Medicare, you can use the money you have in your HSA to pay your deductible for your Medicare and your out-of-pocket costs. And so either way, if you can afford it, you have, again, moderate to low income, usage of your healthcare, you can save a lot of money on taxes.
Wow. I mean, this advice is absolute gold. I never would have thought to do that. And especially the bit about calling the pharmacist, like the medication company itself, and asking for rebates on certain medicines. Never would have thought to do that.
Yeah, it's sad that you even have to go there. You should think, hey, this is the best price when you go to the pharmacy, but they don't. And there's a lot of advertisements you might see, like the cards, the special discount cards. I would check with those companies too. I won't give any specific names because I don't want to be company specific, but there's some discount medicine cards you can look out at, and then you can check up for discount on your medicine and then pay out of pocket. Sometimes paying out of pocket might be less than using your insurance. It doesn't seem like it should be, but yeah, I definitely think you should always ask if there's a better price.
Yeah.
It's like buying, contracting, right? It shouldn't be that way. You should always get the best price, but the healthcare companies are trying to, it's for profits, and most health companies or providers are trying to make a profit. And so if you don't ask not, what not,
The marketplace, it is how you have to, as the consumer, the burden is on you, and being in the healthcare field myself, the thing that I'm used to hearing people complain about is the barriers to care when it comes to actually accessing a provider, in the mental health field. And they talk about how hard it is to find a provider. And then once they are allocated that provider, whether or not they have a good rapport, whether that provider, and this is mental health space, is trained and skilled in the areas that they need to have particular help in. But after that, after you meet that provider and you have that appointment, it's as if the game starts all over again, because then you have to be calling around, checking medication prices, checking with different pharmacies. It is an absolute barrier to care. And I think that it's easy for a lot of people to say, well, I'm just not going to do it. I'm going to leave my mental health untreated. I'm going to leave my physical health untreated, because I simply do not have the energy to engage in this high level of fact finding and comparison shopping when it comes to my health. And it just continues to blow me away, because where I'm at now in the country that I live in, I have been here like it'll be 2 years in March. So about a year and a half. I have not seen a single advertisement for medical.
Medicaid.
I have nothing. No, there's no billboards. There's no radio ads. There's no TV ads. There's nothing coming through social media, nothing in my algorithms. It is 100% handled by the country. And I pay a flat fee. And then if I have out of pocket, it's a clearly stated out of pocket expense. It's transparent. There's no surprises. If you can't afford it, you can't afford it. And if they have a sliding scale, if they have a payment plan, you ask, and it's a 2-second conversation. And the stark differences just really, they continue to surprise me on how things are done, differently per country, and the absolute like mind-bending and life-changing impact that just simple appointments have had in my own life when I was in the US. I did have to sell a car at one point to pay a medical bill, and it I it just blows me away. And I'm glad that you're bringing it up about how that impacts when you are in business for yourself, because it's one of those things that I think a lot of people don't take into consideration as fully as they should. They might cognitively on the surface say, "Oh yeah, well, of course I know that I need healthcare," but they don't take into account all of the hidden costs, including your time itself. Your time itself in researching this stuff, making those phone calls, trying to get the best rate, trying to get the best price, fighting when you're overcharged, right? Like, it's crazy. The scene cost is the big dollar sign that comes in the mail that everybody freaks out about, right? But then there's all this unseen cost. There's all of this invisible labor when you have to advocate for yourself all over again, like from ground zero with five different companies, five different industries, just so that you can keep your head above water financially. So, yeah, I wanted to bring this up today because you see it from the financial impact. You have your finger on the pulse in terms of what people actually have to do to stay above water, what some of the tips and tricks are that people in your industry use to manage these medical costs. But yeah, I as a consumer and as a provider in the healthcare system, it blows me away every single time that I am talking with people about this. So I thank you again, Manny, because I wanted to get your perspective and your insights on how you see this topic impacting people's financials.
And normally I'm a person who says, look, a sign of your credit worthiness and your, readiness for bigger financial challenges is your ability to keep up with your bills. I would say that's not the case when it comes to healthcare. Healthcare doesn't make any sense. A lot of the budget goes towards Medicaid. So you're paying taxes on your state tax. You're paying healthcare expenses from your state taxes that are withheld from your paycheck, right? And then you have your Medicare premiums from your paycheck that goes into a bucket. You have your premiums at the individual policy level that you're paying. You can be paying. I did the math. I'm paying like a couple $1,000s before I even submit a claim. And I've gotten to places where like I don't understand why my proportion of what I have to pay towards healthcare costs is so much different from someone else. I'm trying to raise a family, and so I stopped trying to look at whether or not I'm paying them as an indication of how I should feel internally. For that matter, it's like I'm doing the best that I can.
Yeah.
I'm just so happy right now that I don't have major health insurance. My wife had a heart surgery 2 winters ago, and we paying that off. Other than that, it hasn't been like a really big issue so far. But if I had to, like, I'm not going bankrupt or selling any assets and that sort of thing. And sometimes it's just, or if I went to bankruptcy, I mean, that's not for me. But if it's for someone else, they don't necessarily need their credit. That might be a consideration. That used to be a consideration. Let me change that, because it did go in your credit report, but more recently they don't put it on your credit report anymore. So yeah, I'm hoping that the prices for the health insurance is, yeah. It depends on when it was done, when it was sent to collections.
Well, they got me. So like my knee surgery that I've had to have knee revision. I had total knee replacement, and then it was incomplete. I didn't know that it was incomplete until it started to break, and I had to go back in and get it revised, right? This is the other thing, the nickel and diming. So it's not just one bill. I think I got something in the mail every few weeks for 18 months. after that surgery, they parsed out things like the radiology fee. And then they had, let's see, it was like x-ray. I got x-ray fee. I got an MRI fee. I got like administrative fee. It was insane. And I thought that I had gotten all of it, right? And I get a phone call one day from a medical collections company. And they said, oh, yeah, you missed one. It was like $592 associated with imaging, right? And so I'm like, okay, I'm going to pay that right now. Well, I paid it. And sure enough, I go on to Credit Karma, which is great. I have no beef with Credit Karma. It's still there. Yeah, it's there as a collections. And that one, they had never even sent the bill for. They sent it to collections. I paid it immediately upon, getting that awful phone call. And it is still on my credit report. And so, thinking as a consumer of healthcare where you have, no option when you absolutely have to have something done, something medical done, the bills just, they never seem to stop. And then God forbid you miss one. And then it goes to collections. They say, oh yeah. They say you can petition to have it removed.
And they'll send it for $5.
Yes.
They'll send it for $5
Yes.
or $20. Yeah, it don't really
And
matter.
you have to constantly fight to get your credit corrected. And I'm glad to hear you say that, people should not be internalizing anything associated with medical bills when they think about their financial, I think you said creditworthiness or their financial health. Like, it is a different world.
It could touch anybody. It has nothing to do with, how well you take care of yourself, what you're eating, you exercise. And so there's a connection, right? Obviously, there's some things proactively you need to do. There's smoking cessation programs, mostly with employer plans. Definitely do that. Get your annual physical. Most employer plans will give you a discount if you do, and you prove it. So yeah, there's definitely some things where there's a connection directly between your behaviors and the price you pay. But for some part, there's a lot of luck.
Yeah.
And I just find myself lucky to not have to pay, $30,000, $40,000, $50,000 on a bill.
Yeah.
And something else I wanted to say as well. We talked about for people who don't want a high deductible plan, there's another plan. It's called a health reimbursement account, HRA. And so think about it as a non-high deductible health plan that you can use, like a PPO you can use along with it. And you can put in, $2,500 or $5,000, but you have to use it by the end of the year. That's the caveat. So there's that option as well if you want to save on a pre-tax basis, but you don't want to spend so much out of pocket with a high deductible health.
Wow.
And so in a lot of cases, there's a calculator. Even for Medicare, for my Medicare folks, you can go online and you can type in on Medicare.gov that you can put in your state that you live in. You can put in the drugs that you use, and it will tell you before the beginning of the next year which Medigap plan coverages or Medicare Advantage plans make the most sense, which will be covered, which will cover the activity and what your total out-of-pocket cost could be for the year. And so definitely use your plan websites. That's whether you're covered by the government, or you're covered by Medicare, try an employer plan, the Affordable Care Act plan. There's usually a calculator on their website where you can plug in your assumptions and at least have a starting point.
Wow. Thanks, Manny.
And
Yeah.
so I would do that every year.
That's good.
Yeah.
Thank you.
Well, this is all good stuff. Health is wealth, and you have to be proactive. It is a financial subject area. We offer consults on it. I'm always surprising people that they think that, they're just going to get investment advice and insurance advice with us. No, it's everything full and completely comprehensive. So keep the conversation going, people. I wish you the best of luck, and hopefully we'll cross paths soon.
Thanks, Manny.
That's it for me.
Bye.
Abbey Durkin and Manny Henson, and wish you a good one.
Bye.
Take care.
The content presented and discussed is purely intended to be general and educational in nature and should not be construed as specifically tailored investment, financial planning, tax, legal, psychological diagnosis, or other professional advice. Any data cited is valid as of the date of presentation, but please know that such data are frequently subject to change. Any investment performance referenced is purely past performance, which is no guarantee of any future performance. Nothing contained in this course should be construed as an offer to sell, a solicitation of an offer to buy, or a recommendation of any security or other financial product or investment strategy. All investment, tax, and financial planning strategies involve risk that you should be prepared to bear. Investment, financial planning, tax, legal, and other professional advice is specific to each individual and entity, and you are highly encouraged to consult with professionals of your choosing before taking any action based on the contents presented or discussed herein.